get punchy. I would like to thank the Indian Working Women's Group for having given me this opportunity to talk on a very, very important topic. And it's very interesting to see Facebook Women's Group creating these opportunities for their members to, for their enrichment and their upliftment. It's really, really commendable. So today I'm going to talk about a very, very relevant topic, and that is cervical cancer screening and prevention. So, what is the cervix? Cervix is actually the mouth of the uterus. So a woman has a uterus, she's got the mouth of the uterus, she's got tubes, ovaries, and the mouth of the uterus which opens into the vagina. So the mouth of the uterus is called cervix, and cancer of the mouth of the uterus therefore is called cervical cancer. Now cervix is a highly, highly dynamic organ in our bodies. So the epithelial lining of the cervix, or the cells which line the cervix, they undergo a lot of changes in a girl's life, from the day she is born to the day she dies, right? So the cells of the cervix, they are different when you're born, they are different when you're young, they are different when you're adolescent or you're undergoing puberty, they are different in your reproductive years, and they undergo changes during pregnancy and during menopause, and the cells look different after you've attained menopause. They also undergo dynamic changes every menstrual cycle. So the essence is that cervical cells undergo a lot of wear and tear throughout the process of a woman's life. Also, this is the organ which opens up during the process of normal deliveries. So you must have heard doctors saying, the mouth has opened 2 fingers, 3 fingers, 10 fingers, 10 centimeters. So this is the organ which opens up to say 10 centimeters for a childbirth and then almost retracts back naturally. So that way it's a very, very important and dynamic organ of a woman's body. So when the cells of the cervix undergo some form of cancerous change, we call it cervical cancer. Now, cervical cancer is the second most important cancer of India after breast cancer. So in India, we have common as breast cancer, then cervical cancer, and then oral cancer. So I'm sure most of us have heard more about breast and oral cancers. Somehow cancer cervix is a little subdued compared to other cancers, though it's unfortunate, but that's the precise reason why we are conducting this session. Even in the global picture of cancers, India contributes to about quarter number, like about say 26% of the global cervical cancer is contributed by us. So it's a dismal picture that way. And in India, the cancers that we have, again, cervical cancer contributes to about 25% of cancers which exist in India. So now, what are the predisposing causes or predisposing factors for cervical cancer? So if you have multiple sexual partners or starting intercourse at an earlier age, living in an hygienic environment, low socioeconomic status, all these are other factors which make, or immunocompromised status, these are other factors which make a woman predisposed to cervical cancer. But research has found that association of a virus called the human papilloma virus, which we will now call the HPV virus in short. So the association of HPV virus with cervical cancers is extremely strong. So what is this HPV virus or human papilloma virus? So whenever a woman has sexual intercourse, even if it is with the same partner all your life, each sexual intercourse puts you at a risk of acquiring the HPV infection. It's like the other infections, it's like roughly maybe the common cold of the vagina. So if you get the HPV infection, every sexual intercourse is putting you at a risk of HPV. Now, most of these HPV infections, they get washed away from the body with time. The time could be 1 year, could be 2 years. So with time, the HPV infections get washed away from your body. HPV infections, they stay in the cells of your cervix and your vagina. So HPV can stay in those cells, and if it stays on there for a very long time, then slowly and gradually it begins to bring cancerous changes in the cells of the cervix and gradually develops a cervical cancer. Now, this does not happen in a day or 2 or months or 2 months or years or 2 years. HPV or cervical cancer gives you a window period of roughly 10 years. So on an average status. So if someone acquires an HPV infection which stays on in the cells of their cervix, it might take up to 10 years for the cervical cancer to develop. And in the meantime, before the frank cancer manifests, it gives the cell's precancerous changes. So pre-cancer 1, pre-cancer 2, pre-cancer 3, and then after that one develops a cervical cancer. So cervical cancer is one cancer which is giving us a long window period to detect it, and is also giving us a vaccine to prevent it. And then if we are contributing to 26% global load of cervical cancer, we really need to look into it, why this is happening, right? So now this human papillomavirus has many strains. Like most viruses, this virus has over 200 strains. Now, all of these strains are not oncogenic. Oncogenic means cancer-causing strains. So some of these strains have been identified as cancer-causing strains, and we call them oncogenic strains. HPV also causes other infections like warts, plantar warts, oral cancers, oral warts and other. But right now we are focusing on the oncogenic strains of HPV. So few specific oncogenic strains of HPV have been identified. And what we have done is we have a vaccine against this human papillomavirus. So like children are vaccinated against various infections. If a girl is vaccinated against the against HPV virus or given the HPV vaccine, she doesn't develop infection to those strains of HPV against which she has been vaccinated. So if you don't develop those HPV infections, you eventually don't get the cervical cancer. Now, one thing we have to understand is that not that all HPV infected women will land up in cervical cancer. But yes, all women who have cervical cancer have been infected with HPV. So it's like a reverse correlation, right? So we have a vaccine against this very HPV, and it's like once you nip it in the bud, you don't get the infection, and so you don't get the cancer, right? Now, the next thing you have to remember is we obviously can't have vaccine against all the strains or all the oncogenic strains. So we primarily have three types of vaccines, right? So one is bivalent, one is quadrivalent, and one is nonavalent. So vaccine against 2 most important strains, vaccine against 4 most important strains, and vaccine against the 9 most important strains. So the advent of the nonavalent vaccine is yet to get in full swing in India. The most commonly used are the 2 strains and the 4 strains vaccines. There are different dosage schedules of the vaccines. So some vaccines are given like at the first dose, then after 2 months, and after 6 months. Some vaccine is given at 0 dose and after 1 month, and again after 6 months. So depending on which brand you're getting vaccinated with or which type you're getting vaccinated with, your doctor can advise you on what should be your dosage schedule. The ideal time to administer the vaccine. Now let's talk about that. So the vaccine, earlier we used to administer it to girls from 9 to 25 years of age. Then it got pulled on to 45 years of age. And today, in the present day scenario, we can vaccinate females from 9 years to up to 65 years of age. The best time to vaccinate a woman is, or a girl rather, is around 11-12 years of age. Just before, the ideal time to get vaccinated is before the onset of sexual activity, so that you're primarily protected. Also, the earlier the vaccine is given in a girl's life, the better the antibody response it generates, as a result of which better is the protection. For girls, when the vaccine is given less than 15 years of age, they just need to receive 2 shots. After 15 years of age, we need to receive 3 shots, right? And as of now, there is no recommendation for the booster of the vaccine. So once you finish your primary course, it's assumed that you are immune almost for lifetime. Now, a lot of women ask that in older age group, is it advantageous to give the vaccine? So as I said, the earlier the vaccine is given, the more is the antibody response generated and you are better protected. But as long as the benefits of giving the vaccine outweigh the risks of not giving the vaccine, it is worthwhile giving this vaccine. This can even happen till later ages, which is till 60 and 65. So now the next question that should come to a viewer's mind should be, what if I am already sexually active, or what if I am already infected with an HPV? Then is it advantageous to take the vaccine? So the answer to this is yes, it is still advantageous to take the vaccine, because even if you are infected with HPV, it is not likely that you are infected with all the strains. So the vaccine protects you against infection with the other strains and also against reinfection with the same strain. So So by administering the vaccine, even if we are able to save minuscule, though we normally save a lot of women from getting cervical cancer, but in age groups or in settings where it may not be so, even if we can save a small percentage of women from this deadly cancer, it is totally worth it. Right? In cervical cancer vaccine now is a very important part of the premarital counseling that women or girls come to us with. So the ideal time to get the vaccine is before onset of first sexual activity. If you have not been able to get it, then maybe before your marriage. If you have not been able to get it that time, then maybe immediately after your marriage. Till you have many couples after they get married, they want to take a break before planning a pregnancy. So that is also a very good time to take the vaccine. And suppose you have not been able to take the vaccine even then we normally vaccinate women immediately after delivery. So there are multiple reasons. So the thing is like that, the reason we administer immediately after delivery is not because it's a protocol, it's just because the woman comes for regular checkups at that time. So during her regular visits, the vaccination happens. And also, while you are on the 6-month schedule of the vaccine, we normally advise women to avoid getting pregnant. So if we know that a woman is pregnant, then we do not normally vaccinate her with cervical cancer vaccine at that time. But just in case the vaccine gets administered to a pregnant woman, it's not an indication for abortion. So post-delivery, most women do not want to plan a pregnancy again in the next 6 months. And also they're regularly coming still to the doctor for checkups. Also they're coming to the hospital for the child's vaccination. So in one visit, everything gets done. It's comfortable for the patient to get vaccinated. So if you have daughters who are in that age group, if you have nieces, cousins who are in that age group, kindly encourage them to get vaccine as early as possible. Young girls should be vaccinated around 11 to 12 years of age. So at that age, it's the mother's responsibility to take the child to the doctor and get the vaccine done. We also have to remember that pediatricians are also giving this vaccine regularly, which is very good. But I normally encourage a mother to get her daughter to a gynecologist at that time for the vaccine. The reason for that is very simple. Girls at that age are undergoing a lot of bodily changes. It's pubertal time, and they may have a lot of questions and doubts in their mind, which sometimes they may not be comfortable even in discussing with their mother. So if you get her to a gynecologist, it gives her an opportunity to discuss all her apprehensions, all her doubts to the doctor. Through the doctor, get the right information which she's been wanting to know. So it's a very good opportunity to encourage her to interact with the gynecologist. So I often tell patients it's a very good idea. So break the ice and get her to the gynecologist for the regular schedule of the vaccines. So as far as side effects of the vaccine are concerned, often patients ask, doctor, are there any side effects of the vaccine? Is the injection very painful? As of now, there are no real side effects that are known for the vaccine, and apart from the little prick of the injection that we get, it's not really that painful to get the vaccine. So this is primarily, we have spoken about the prevention. So I want to emphasize again that cervical cancer is a cancer which is caused by the existence of the human papillomavirus, and we have a vaccine against the virus. It's just that we have to break our inertia and go and take the vaccine in time. Prevention is better than cure. We all need to remember. Now, let us also talk about a little bit about the screening of cervical cancer, right? So as I said, if you develop the infection, then it gives you a long window period before you develop the cancer. It gives you pre-cancer stages 1, 2, 3 before you develop the cancer. So it is very much possible for us to catch this cervical cancer in its pre-cancer phase, right? How do we do that? We do that by regular tests called pap smears. So I'm sure most of you have heard about what a pap smear is. So a pap smear is a cytological test. So what a gynecologist does when they do a pap smear is that, like, it's a routine gynec checkup. The secretions which are coming out of your cervix, we just take a thin portion of those secretions, and there are 2 ways in which we can do the pap smear. One is the traditional pap smear, in which we just spread those secretions on a slide, and then they are looked upon by a pathologist or a cytopathologist in the microscope. The other is we take those secretions and we through a brush, okay, and we put them in a liquid. This is called liquid-based cytology, the LBC pap smear. Okay, both of them are almost the same. Now they have the same purpose. Okay, the LBC is more sensitive than the routine pap smear. So what we do in this is we detect existence of any abnormal cells, which maybe there are criteria to call the cells abnormal. So through this we can detect whether the cells of the cervix are totally normal or they have any kind of precancerous changes. If they do, then you can be recommended for repeat pap smears, for HPV tests, for colposcopy, and you can be worked up, and it can be picked up much before, and it can be picked up and treated much before you actually develop an advanced cervical cancer. Okay, so when should you get screened and what's the right time to get screened? So according to our recommendations, pap smear screening should start at roughly 21 years of age. Okay, and it should continue till 60 years of age. So for women between 21 to 29 years of age, we recommend that every 3 years one must go in for a pap smear screening. So if your previous pap smear is normal, everything is okay, your gynecologist has given you a clean signal, then the next pap smear can happen at, say, 3 years from the previous pap smear. For women from 30 to 60 years of age, there are 2 recommendations. One is the same as this, pap smear every 3 years, and the second is a pap smear along with an HPV test every 5 years. So what is this HPV test? It is done in the same manner, and the pap smear looks for cytological changes or changes in the cells of the cervix. The HPV test detects existence of the HPV virus in the cells of the cervix. So the HPV test improves the sensitivity of the pap smear test, right? So if you are doing the HPV along with the pap smear, then you can repeat it every 5 years till 60 years of age. Now, if you've had previous 2 or 3 consecutively normal pap smears, then the screening can stop at 60 years of age. Otherwise, one needs to continue regularly. Okay? If there's anything wrong in your pap smear, I'm sure your gynecologist will advise you as to what needs to be followed up, what needs to be done, how it needs to be treated. That's what a pap smear is all about. Okay? So now the other thing is the right time to get the pap smear done is like there are a few prerequisites. For about 2, it should be post periods. We normally don't like to do it within periods. So once you're periods and in past 48 hours, there shouldn't be any vaginal manipulations. Like you shouldn't have used any ointments or had intercourse or used any pessaries. So we like a naive vagina for 48 to 72 hours before we like to do a pap smear. This is about the pap smear. Now, as I said, the liquid-based cytology is a little more sensitive than the normal pap smear test, but it's also a little more expensive. If there is an option, you should opt for the LBC pap smear, but if there is no option, a normal pap smear will do you just as good as this. The other thing is, often there is a question which comes, so if you've been vaccinated already, do you still need to undergo pap smear tests? So the answer to that is yes. Even if you've been vaccinated with cervical cancer vaccine, you still need to undergo your routine pap smear test. And let's just look at it very logically. Once in 3 years, once in 5 years is hardly your cervix is what it's asking for. Hardly any time. And that much time one really needs to give it, because this is one cancer which is giving you a mode to prevent, a mode to screen. So we should really not allow it to happen to any one of us. And the sad thing of cervical cancer is if it gets ignored, it normally gets detected in the advanced stages, and it's really very unfortunate. It's just about breaking your inertia and going to gynecologist every 3 years, 5 years. And some important symptoms that can come up if you have a cervical cancer, or you could have a very important symptom is postcoital bleeding. That means bleeding or spotting after sexual intercourse. So there are other causes which can cause the symptom, but this is one of the very important causes of postcoital bleeding. There can be foul-smelling discharge, some chronic pains, other symptoms which are mainly non-specific. So since the symptoms are so non-specific and cervix is an organ placed inside, so you have to check it every time, often it gets ignored. That undermines the importance of getting a regular pap. Now, if you've had a hysterectomy or if you've had a uterus removal, then you need not go in for regular pap smear screening, provided your uterus removal is not done for any cancerous reasons, it's done for any benign cause, then you need not go in for a regular pap smear screening. Also, sometimes, rarely, the entire uterus doesn't get removed and a portion of the cervix remains behind. In That's what we call as a subtotal hysterectomy. Obviously, it's not total. In case you had a subtotal hysterectomy because of whatever reason, then you still need to undergo regular pap smear screening because your cervix is in place, right? So this is what is about pap smear screening and your cervical cancer screening. I've covered most of the points of your cervical cancer screening and prevention. And I can also see a few questions. Can vaccine be given if I have PCOD? Yes, the vaccine can very well be given if you have a PCOD. In fact, this is one of the safest vaccines to give even in other conditions. It does not per se have any contraindications. So the advantages of giving this vaccine far, far, far outweigh any little risks that may be associated with, though we are not even aware of any risks as of now. So yes, you can take the vaccine even if you have a PCOD. There is absolutely no issue. I also see another question which says, last year my PAP report was ETSIL. What does this mean risk-wise for cervical cancer? Yes. So now ETSIL is a pap smear report which says high squamous intraepithelial lesion. So this needs to be looked into. You may need a repeat pap smear. You may need a colposcopy, which is looking into the cells of the vagina and the cervix through a microscope, so under magnification. And you may need a biopsy to confirm the report of ETSIL. In such cases, we also need to see, because pap smear we have to understand is a screening test, right? So we understand what's a screening test. It's a population where we do in a test and we just screen the population. And once someone turns out to be positive, then we run a confirmatory test. So if you've had an HCl, a few things that you may need are a repeat pap smear, a colposcopy, a biopsy, and depending on the biopsy, further we'll offer you treatment as to what should be the next step of treatment depending on all these reports. Yeah. And someone else is asking, if a girl is now 20 years, which vaccine should be given for her? 20 years is a good time to give the vaccine. There are two types of cervical cancer vaccine right now available in India. I'm sure once you go to the doctor or if you come here, we can vaccinate you. We'll guide you as to which is the right dose or which is the right type of vaccine that you need to or the girl needs to get. Okay, some questions which I missed before this. Someone's asking what signs should we look for. So I assume she's asking about what signs for cervical cancer should we look for. I think I talked about it just a few minutes back. So the signs that you should look for is any abdominal or foul sweating discharge, bleeding or spotting post-intercourse, chronic fatigue, pains, and the other symptoms are a little non-specific. So you must go for regular screening to your doctor, your gynecologist, so that she can ask you about signs and symptoms and do a very regular screening for you so that you are safe from this. Okay, ma'am, what is the right age for getting cervical screening? So cervical screening should start from 21 years of age. Every 3 years, roughly, it's easy to remember, every 3 years a pap smear screening till you are 60 years of age is the right time or the right age, she's asking, for cervical cancer screening. We have a question, says, can we take the vaccine at the age of 34? Of course you can take the vaccine at the age of 34. As I said, the advantages of administering the vaccine far outweigh the risks of not giving the vaccine. That is why even at the age of 34, it's not late. You must opt in and take the vaccine. Whatever prevention you can get, you must get. Ma'am, I read somewhere something like this is related to boys also. So is it true? So as of now in India, we don't vaccinate boys, but some countries do vaccinate boys, and if you vaccinate boys, it can prevent cancers like penile cancers, cancers of the pelvis in boys, and also some form of warts. But as of now in India, we don't really vaccinate the boys on a regular basis. We vaccinate girls from 9 years onwards. A few more questions which we'll be taking. Does the vaccine help in recovering PCOD also? So the vaccine doesn't really have much in treatment of and management of PCOD. It's particularly for prevention from getting the HPV vaccine. from HPV virus. So it doesn't really have much in preventing or recovering from PCOD. That's a separate identity. If any woman is in early menopause at 32 years of age, so what for her? So if someone's getting a menopause at 32 years of age, then it's the premature menopause. That's a separate identity, and the factors causing the premature menopause need to be looked into, and also what management has to be given to her needs to be looked into. But considering her age, she's still eligible for the vaccine and she must take the vaccine. My daughter is 12 years. Which vaccine is for her at this age? As I said, 12 years is a very, very good time, and I'm so glad that you're already considering getting her and taking the vaccine. Please get her to the hospital. We'll guide you about which is the right vaccine to be given to her. As I said, primarily 2 types of vaccine are being used rampantly in India. We shall definitely let you know advantages and disadvantages of both, and which one would be the right one for her. I am 44. Can I take the vaccine at this age? Yes, you very well can take the vaccine at this age, because the advantages of taking the vaccine are much more. So even if you are 44, you must take the vaccine, especially if you have an active sex life. Is there any age limits to take the vaccine? Oh yeah, okay, it's the same question. As I said, with the advent of the vaccine, and as the spectrum was increasing, earlier it was given to women till 25, then it was given till 45, and in the current scenario, we give vaccines up to 65 years of age. So 44, you can definitely take the vaccine. There's absolutely no issue. We would encourage everyone to take the vaccine. So if there are any more questions, I would love to answer them. I hope I've answered your basic queries and that the session has been informative. It's a session of paramount importance. We have to understand that prevention is much, much better than cure. Cervical cancer is somehow an ignored cancer. Though it's very, very easy to detect this cancer, and we have a vaccine against this cancer, so we must actually tap on all the advantages that the cervical cancer per se as an identity or entity offers to us. So I really would encourage all of you all to get vaccinated, to get your children vaccinated, to get all the young girls who are in your family to get vaccinated. And if you're counseled by your doctor, please kindly immediately take the vaccine. Go to the doctor and tell her, I want to take the vaccine. And please regularly opt for a regular pap smear screening. Please ask yourself today after the session, when have I last had my pap smear? And if the answer is not within 3 years, please come to the hospital. We shall do your pap smear. We shall give you the vaccine. And even during COVID times, all precautions are being taken at the hospital. Safety of patients. Please go in proactively and give your health priority so that you can prevent yourself from this cancer. Okay, there are a few more questions which are coming up. I would like to take them. Is it okay to have periods at the age of 53? So the average age of menopause is getting pushed from 50 to 52 to even 55. If the rest of your tests are normal, your hormones are good, it's really good, you can carry on. But it's a good idea to just take a consultation from a gynecologist so that she can look into other factors. And if all is well, you should just wait for your normal menopause to come. Okay. Some 2 brands available in India right now are Cervical and Gardasil. And doctors will decide which one is best to give you depending on when you come to us. Thank you so much. Someone saying excellent session. Very, very, I thank you for the appreciation, and it's really, really very encouraging. And I hope I have been informative, at the same time interesting to all of you. The message that I want to give you is better than cure. The take-home messages: give your health priority, and please make a vow that you will prevent cervical cancer in yourself and your immediate vicinity. So please ask all your friends, your cousins, all your relatives, have they had their pap smears, have they taken their vaccines? This is the biggest social service we can do in current times. Thank you so much for joining my session. Thank you so much. Bye-bye.